So today we'll talk of liver transplant for people who suffer from liver diseases across the world. Hello to all. I am Dr. Zubin Dev Sharma. I am a senior consultant gastroenterologist as well as a hepatologist. And today I think we'll talk of an important treatment which is being used quite a lot across India and across the world now. And it's something that we don't get enough information about. So today we'll talk of liver transplant. Now, liver transplant is a treatment technology, is a management tool that has been developed in the late 80s and 90s, and now it's one of the established treatment algorithms or treatment methods for people who suffer from liver diseases across the world. Now, here we'll talk of that where all do we really need liver transplant, in which diseases do we need to do a liver transplant, what are the types of liver transplant that can be utilized, and usually what are the possible complications and late management things that are along with associated with the liver transplant. And very briefly we will also try to understand what is the cost involved in India, at least when you talk of liver transplant. So let's talk of liver transplant. So liver transplant is broadly required for two kind of illnesses. One is if you have a liver cirrhosis, that means your liver is not functioning well, which is decompensated. What it means is that you are having complications because of liver cirrhosis. What are the complications that can happen from a liver cirrhosis? Complications are like you will have fluid in your tummy, which is called as ascites. You may be bleeding from various abnormal veins that develop around your foot pipe, which are called as varices. You may be dealing with brain fogging because of liver injury or liver disease, which is called as a hepatic encephalopathy. You may be dealing with a kidney injury because of underlying liver. Finally, fifth, you may be having something called as a hepatocellular carcinoma or simply liver cancer with an underlying liver cirrhosis. So these are the 5 or 6 complications that can happen in a patient who is suffering from liver cirrhosis. Now, when we talk of these complications, we also have to know why did the patient actually had the liver disease in the first place. So what are the common things? You can have things like hepatitis B or hepatitis C. The commonest nowadays is fatty liver disease or metabolic associated liver disease, common in diabetics and patients who are overweight. You may have other rare phenomena, something like metabolic liver diseases like hemochromatosis or Wilson disease. Alcohol is something which is very, very common in developing countries, particularly India, and I'm sure all across the world now. Alcohol associated liver disease is something which is very common indication to undergo liver transplant. So when you have at least one, maybe 2 of these complications, and because of all the above reasons, you become a candidate for liver transplant. Now, liver transplant can be broadly divided into 2 different types. Across the world, the commonest type is something called as a diseased donor liver transplant or DDLT. What it simply means is that you have a donor, a donor who has been declared as brain dead. He may have had an accident or some other illness when he is brain dead. It is clear for the family that the patient is unlikely to come out from his neurological injury, and they decide to donate their organs. That's the commonest thing done in the West, that means in Europe or US or other countries. There they have a predominant DDLT liver transplant program. In India, there's one more kind of a liver transplant called as a living donor liver transplant. What it means is that a close family member who is also your blood relative, share the same blood group with you, can donate a part of its liver to you, and with time the donor liver also grows and the donated liver in the recipient also grows, so both the people are fine and they can live their normal lives. This is called as a living donor liver transplant. Now, in which setting you should be using what? So living donor liver transplant is for somebody who do not have too much time in their hand. They can't be on the waiting list for a diseased donor liver transplant, and they decide in a conscious decision in front of a chair. You decide, you tell them that yes, I want to donate my part of the liver. I understand what are the risks involved undergoing a surgery to remove a part of my liver and give it to my family member. Whereas a DDLT program, if somebody who is having a long-term illness, something like a cirrhosis, and is in a country where DDLT program is active, you have a national registry, and you have, everything is in place to get that listing in place. Now, after we have understood these different types of liver transplant, what is the life of a patient after liver transplant? So see, the recipient, the success rate is almost the tune of 85 to 90%. They do well. It definitely gives you a much better quality of life as well as longevity of life. There are certain immunosuppressive medications that the recipient has to take for the rest of his life, otherwise there would be a rejection. This may be a couple of drugs, and like any other drugs, there will be some complications associated with it. There are other structural complications that can also happen in the immediate post-operative period. Things like leaks or strictures, we basically mean that anastomosis, or the point where they join the bile ducts together, they may have some leaks there, which requires further management like an ERCP or a treatment or stenting. So all these factors are there. So it's like your quality, you are basically doing a transplant to improve your quality of life and definitely for your longevity of life. But there are certain things which as a recipient you have to manage in your life. Of course, the underlying factor of why the liver actually got bad in the first place has to be managed. Now, what is the average cost involved in India? So in India, there are a lot of private hospitals which help out in liver transplant. There are very limited government centers which offer liver transplant. I think the cost even in a government center would be around 12 to 15 lakh Indian rupees. It can vary in a private setup from 18 to roughly around 25. All these are ballpark figures. All these are figures which are out there, but you have to individually go to these hospitals and talk to them regarding the cost involved. The DDLT program in India is much more active in southern part of the country, whereas in the northern part of the country you have much more LDLT or living donor liver transplant. It has to be from a family member, it has to be from a blood relative. That's the law that we have currently in India. So if you need any more information regarding liver transplant, you feel free to message me and I'll definitely share the information from you. Thank you so much. How to connect to us? I think it's not very difficult. The number is given. On this number, you can message us, WhatsApp us. A message will come back to you on how to take appointments. Appointments can be a physical appointment or an online appointment. A physical appointment is available at Fortis Memorial Hospital in Gurgaon in Haryana. And for online, there is an app which will be given in the message itself. You can also try to connect to this number. You can call this number. The coordinator will pick it up and guide you if you have any problems in trying to take appointments. So please feel free to message us, and the appointment is not difficult. As soon as you WhatsApp us, you will get a message for it. It may be some delay because there will be a lot of work going on, but you will definitely get a message. So thank you so much.